At the far end, we have Thom Craig. Thom Craig is the Director of Mental Health Programs with the Margaret Clark Morgan Foundation in Hudson, Ohio. The Margaret Scott Morgan Foundation has a strong focus on improving the lives of people with serious mental illnesses by investing in innovative projects in Northeast Ohio that have a national transformational impact. I met Thom a few years ago. He's working with a group of health-focused foundations working around the Affordable Care Act and how to implement the Affordable Care Act in Ohio. Thom has had over 30 years of experience working with people diagnosed with both developmental disabilities and mental illnesses. And Thom's interest in creating responsive community service was influenced by his brother Joe's life journey as a person diagnosed with profound autism. Next up, we have Rita Horwitz. Rita is the Director of Business Development and Operations for Better Health Greater Cleveland, a nonprofit regional health improvement organization. At Better Health, Rita works with key stakeholders to facilitate value-based healthcare transformation to achieve better care experiences, improve management of chronic diseases, enhanced access, equity, and lower cost of care. She's a member of the Cuyahoga County Health Improvement Program Leadership Team, Ohio State Innovation Model Design Work Group, and co-chair of the Ohio Patient-Centered Primary Care Payment Reform Learning Center. And we also have Michael McMillan. He is the Executive Director of Market and Network Services for the Cleveland Clinic. Michael's accountable for all aspects of the business relationship with health plans and employers, including managed care business development, network management, contracting, and sales. He is also the Vice President of the Cleveland Clinic Community Physician Partnership, which is a network of more than 3,500 independent community-based physicians. And he also serves as the clinic's representative on the Governor's Advisory Council on Health Payment Innovation, which we heard Greg talk about. So thank you all to our panelists. I'm going to start by asking a couple of questions, and then we're going to open it up to the floor as well. But first of all, let me just open it up by asking the three of you, how are you aligning your work with the state's vision that we saw in Greg's presentation? Oh, so Michael.
First of all, I'm very happy to be here to describe a little bit about what we're doing in the space of innovation and healthcare transformation, which is very consistent with the vision that Director Moody outlined, which is exciting, important, and really pushes forward a very significant agenda to improve healthcare for Ohioans. So there are probably three aspects of this that resonate with the work that we're doing here at the clinic as we respond to reform and as we respond to changes in the marketplace. The first of those is the area of care transformation. So at the level of interaction between the patient and caregiver, how do you improve the fragmentation? How do you provide enhanced outcomes? And how do you better coordinate the care that patients receive from a complex organization for their diverse and varied needs? So we have a significant initiative in place to transform care through the development of care paths, a standardized approach to providing care that involves not only caregivers at the Cleveland Clinic, but caregivers in the community, caregivers at other organizations related to us, independent physicians, and really integrates all of that activity in a seamless fashion through the use of the electronic medical record. Tied together with predictive analytics so that caregivers in real time can understand their performance and understand the need of the patient that is in front of them. The second important initiative that resonates as well is our work with the private practice community and other organizations who provide care that patients receive. So, folks get care not only from Cleveland Clinic medical group physicians, the 3,000 folks who are organized in a group practice here, but from many physicians who are in the private setting in the community, from other community agencies, and working with all of those organizations to integrate care through this organization we call the Cleveland Clinic Quality Alliance, which provides a platform for private practice physicians and the group practice to work together in a seamless fashion. We have implemented two other very important initiatives related to care transformation. The first of those is the primary care medical home. So the Cleveland Clinic is a NCQA recognized level 3 medical home, and also just received accreditation from the Joint Commission as well, providing medical home services to over 250,000 folks at 29 sites across our system. So we're in the process of transforming the way care is delivered in the primary care setting to a medical home context, which will provide better continuity, better coordination of care, and appropriate interactions between patients and caregivers. Part of the medical home is care coordination to make sure that patients can always make the right connections, because as we all know, patients frequently leave a physician's office unclear about the next steps in the treatment process, so a care coordinator can help get that together better. And then lastly, we've done important work in the area of episodic payment. And this is, at the moment, been really on two fronts. We have worked in the commercial sector with large employers to bundle payments for folks who travel to the Cleveland Clinic for health care and build systems, both clinical and administrative, to accomplish that. Then we are a participant in the Medicare Innovation Project around bundle payment, which actually resonates very closely with what the state of Ohio is doing. And so we've got deep experience in building this. So we're energized by the vision. We're excited to be working in healthcare at this moment. There are tremendous opportunities to improve the care of patients and to create better outcomes for the folks who access us for care.
So again, I'm Rita with Medical Creator Cleveland, and I think you heard Gregory say that, you know, the power of transformation lies in collaboration and the power of partnership to get that done at a community level. And fortunately for Northeast Ohio, Robert Wood Johnson had the insights some 6 or 7 years ago to say collaboration is the way to do this at a local level. And they funded 16 communities across the United States, and Cleveland was one of them. Southwest Ohio, Cincinnati, who has the CPCI initiative, is one of our sister collaboratives. And that, in fact, is the work we've been doing over the past 6 years, is trying to create this groundswell for changes in the care delivery system and changes in the payment system. We have been working very closely with the SIM work groups in Columbus on a weekly basis to help with the design of the couple of tracks that you heard mentioned today, particularly the patient-centered medical home and the payment innovation models as well. So for 6 years, we've managed to put a membership model together, and we have now as many as 700 primary care providers, 70 practices, 10 hospitals. We have large self-care employers, we have health plans, and many, many community organizations that I see here in the audience today. The clinic is also one of our members and partners. And we've been working together for 6 years to drive improvements, to get us to better care, to get us to better health outcomes, and to get us to lower costs. And through our practice coaching program, we've been able to use and take a look at a lot of the data that these practices send to us, particularly in the areas of chronic disease, so diabetes and high blood pressure and heart failure. And our coaches have been able to look at that data and see where are things going really, really well that we can share amongst our membership so everybody can get better, and where might practices have some needs or a need for extra help that we can go in, parachute in, and help them to get better as well. And so we've assisted with maybe there's close to 30 now patient-centered medical homes that are NCQA recognized in Northeast Ohio, and we hope to have many, many more. Additionally, we have helped to facilitate 2 pretty significant payment reform initiatives here in Northeast Ohio. One of them is called our Red Carpet Care Program, and that payment reform initiative is really promoting patient-centered medical home, care coordination services, great use of health information IT to do population management of these very, very high-cost, high-risk people that you heard regularly mention. These are the folks, not a lot of them, but they spend a lot of money and they have a lot of unique needs. So we are in the midst, 1 year into that program, and that involves a commercial payer and a Medicaid payer and a health system here that I think that we are starting to see some movement on the needle in terms of better health outcomes for those folks and lower costs. The other payment reform initiative is unique in that it is employer-driven. We are working with the Health Action Council of Ohio, and 3 large self-insured employers stepped up and said they want to get their health of the workforce to a much better place, particularly those with chronic conditions. And so we were able to facilitate an accountable care arrangement with a local health system for those employees as well. So I think we're in lockstep with where Ohio is trying to go. We're thrilled to see the leadership that the governor is taking in this regard. I think it will help us get much of this that we've been doing here for 6 years to scale.
I'm Thom with the Margaret Clark Morgan Foundation, and our foundation really focuses on the folks who need health care and other kinds of services the most, those who have the most chronic and severe mental illness issues. And one of the areas that we thought we would really try to focus on was how to improve. We know a lot of the things that work. We know that people with mental illness were dying earlier and that we needed to make sure that they had